Good morning. We are going to talk about TMJ. I am not a ventriloquist. So the TMJ is the temporal mandibular joint, and it's this joint here. It's the jaw joint. And for some people, they have a lot of problems and pain with the TMJ. The TMJ has many, many nerves that surround this area here. And so those nerves can be irritated by the joint being out of alignment, and it can give you, of course, jaw tenderness, tenderness up here, which is one of the big muscles. There's a big muscle that is right here in the temporal mandibular area, and it attaches right here. And so when you are opening and closing your jaw, if it's not in the right alignment, then that muscle's going to work harder, and it can give you headaches. It can give you ear pain, ringing in the ears, face pain, and neck pain, and a lot of things. So the TMJ is a very important joint. It has a little disc right here, and I don't know that you can see it, but it's a plastic little disc where the joint actually fits in, and we have that disc in our joint, and it's meant to protect us so we're not bone on bone, but it can wear out. And so when it wear out, it dries out, and so it can roll and pull off the bone. And some people, when they open their jaw very wide, that piece can roll, and then they can't close their jaw because that's stuck and in the way, and that's pretty painful. The reasons why people have TMJ is they will clench. Some of you are clenchers in the middle of the night, and you can't stop that because you're not conscious. And a lot of times it can be because that you have tension and anxiety running through your head, and so you're gritting at nighttime. And so it's hard to stop. Some people have to go to their dentist to get protection on their teeth so that they don't wear their teeth down. They get the mouth guards. And so it's a big thing. And so I want to tell you about what chiropractors can do. We talked about the clenching of the teeth. We talked about general tension. When you're in a tough situation and you're like angry or anxious, you might clench, and you can see right here. And I'm making a lot of noise, but that's how that muscle called the temporalis muscle gets tight, is that we're angry. And if it gets tight, then it affects how our jaw opens and closes. The jaw is like a swing, and so if a swing is being hung by a rope, and at the bottom is the place that you sit. So if one side is tight and the other is not tight, then what happens is when it drops down to talk, it'll pull to one side. It'll pull to one side. And so then this one's being stretched and this one is tight. So it can be a muscular reason. One of my patients was playing basketball. And so he was playing basketball, and just about the time that he opened his mouth, he got hit by the basketball, so it really pulled his jaw out of alignment. Now, I'm exaggerating that because I can't control this jaw very well, but that's what it did. And so when we went to adjust him, I actually did a manual adjustment, meaning I used my hands. It made a huge noise when it returned back to its normal alignment. The other cause for TMJ is that our teeth will wear out, and it could be that you've worn them over time, so they're flatter on one side, or maybe you have a cavity or dental issues, and it changes your joint or changes the way that the joint moves, and so that can set up pain in the head. So those are all the ways that you can have chiropractic. You can have TMJ, and I'm going to tell you how we fix it. So when you come in, what I have you do is I have you open and close your jaw. And if you want to do this right now, you can do it with me. Right in front of this little part of your ear is where the joint is. So when you open and close your mouth, you should feel the same. It should feel symmetrical. So when you open, they should feel the same. But what I see is, what I feel first is, oh, this one's not moving as well as this one. So there's going to be a different in motion. The other thing I do is I look at the chin. So when they open up their mouth, when a patient opens up their mouth and it goes to one side, that's another clue. This side is tight and it's pulling the chin this way. This side is too loose and it's pulling the chin or allowing the chin to go. So we need to adjust the joint. And the way that I do it mostly is through what's called the activator gun. So when I look at the jaw, I feel the jaw, how is it moving? I look at the chin, how is it moving? And if, now I've made the example twice, but if this side is not moving as well, then what I do is I have them open up the jaw, and then I put my thumb on the jaw, and then I adjust using the instrument on top of my thumb so that I have a little bit of a cushion. And so it looks like this. I'm going to do it here. Oops. And it goes very, with a controlled spring. It goes very quickly, but it moves the joint, and then we can balance up the joint, and you have a much more smooth running joint. I can't put this back together a little bit more normal. Anyway, you have a smoother joint, and it moves quickly, and it feels so much better after it's in the correct alignment. As with any misalignment, it always feels better when we correct it. So the chiropractic care is we want to get the joint in the correct alignment, and I will do massages around the face. We talked about the temporalis muscle. When you're in the shower, say you're washing your hair and you have nice lather, it's a little bit easier to be smooth on the hair and the skin. So you want to just rub it. It's kind of a fan-shaped muscle, so you want to go across the muscle strands, and that will help relax it. So you want to rub here. Also, you can, same thing with the jaw itself. There's muscles here called masseter muscles, and they help you masticate your food or chew your food, and they can get really tight. So if you open up your mouth, and then you rub again across the fibers, that'll help. Sometimes it's exquisitely sore, so you want to do it to your own pressure, but any kind of massage on it is going to help relax the muscles, and also is going to help take away some of the inflammation. So because the joint is out of alignment, the joint is rubbing incorrectly, and it causes inflammation, and that makes it very sore. So along with adjusting and massage, and some of that massage you can do yourself, there are some suggestions if you're having tension, like you're anxious and so forth. Some of the supplements that you can have, first, B vitamins. B vitamins help nourish your nerves so that they can calm down, and maybe the anxiety and depression will be minimized with B vitamins. The other one is skull cap, which is an herb, and it's funny that we're talking about the skull. So skull cap is one of those kind of anti-anxiety herbs that help you kind of calm down. Minchex is another one. So Minchex means mineral, and when it has a Chex behind it in the standard process line, that means there's a multiple amount of minerals that will help kind of calm down that anxious feeling. And then ashwagandha. If you have an injury to the jaw, like the basketball player, then your ligaments and tendons could need a little help getting back to normal. And so you need a ligament, or Ligaplex is one that has a lot of nutrients for ligament repair. And then boswellia. Boswellia is an anti-inflammatory, along with turmeric, which is an anti-inflammatory. So those are things that you can do that will help if this is a chronic issue, that will help you have a better chewing ability, and also just normal life, living normal life. It can get pretty tense. So when we can supplement, sometimes we don't get the best nutrients in our diet. diet so we can supplement with a pill or an herb. So I hope this helps. I hope this was entertaining for you, and I'm going to be doing a few more of these so that I can tell you what we do here at the clinic. And we do TMJs all the time, so I'm here to help. I appreciate your time. Bye-bye.